So today we are going to have a really good look at what shockwave therapy is. We're going to have a little look at the machine, we're going to explain how it works, and then we'll also tell you which conditions that we use shockwave for. And then finally, we're going to just show you a demonstration. I'm Gavin Noble from Gav Noble Physiotherapy, and welcome to the 10X Physio channel. This is the channel where we teach you all the top tricks and tips to make your life healthier. Now we're going to look at the actual shockwave unit. So this is our shockwave machine. Acts as an air compressor. So air gets compressed through the hose here up to our treatment head. Inside this treatment head there's a barrel, and inside that barrel is a little bullet. So when the air compresses up through here, the little bullet shoots up and down the barrel, hits onto an end plate here, and then a sound wave is produced at the end. So when we place this up against the skin, that sound wave gets transferred into the skin, and this sound wave helps to kickstart that whole healing process within the muscles and tendons. Now, I just want to stress to you that it is a sound wave, it's not an electrical shock, as some people have expressed in the past. It is actually a sound wave. Now, the conditions that we use to treat shockwave with are things like plantar fasciitis, heel spurs, calcification, Achilles tendonitis, tendinopathy. We can move up to our patellar tendonitis. We can go to an elbow, so tennis elbow, and then also up into the shoulder for rotator cuff tendinopathies or calcification. Shockwave is a very useful tool for us, and it has been approved by NICE guidelines. We use it here quite a lot with runners, as much as with other people who are missing out on walking, gardening, and general play with their children. Now let's look at some treatment for some plantar fasciitis. So first I'm going to apply a little bit of gel to the skin. This helps to reduce friction and lets the head of the shockwave move a little bit more easily on the skin. Okay, then we take the head of the shockwave just onto the skin and we're moving that around. Now you will hear the machine just get a little bit louder as we turn it on here. And we can hold the shockwave in one place, or we can just move it gently over that tender area. And we will treat that for 2,000 shocks. I'm just going to stop there now. Now, if you like what you have seen today, and hopefully you've learned a little bit more about shockwave therapy, please subscribe to our channel, like the video, and again, hit those notification button so that you get up-to-date information on everything that we do. Likewise, if you have any problems with any plantar fasciitis, Achilles tendinopathy, rotator cuff tendinopathy, or patellar tendonitis, please feel free to ping us an email. We will always do our best to help you and provide you with any information that we can. I look forward to seeing you again on our next video. I'm Gavin from Gav Noble Physiotherapy at the 10X Physio channel. Thank you.